Clinical application of O2 therapy for Mindray SV300 ventilator. We are now in the ICU. There is a patient who has mild respiratory distress with SpO2 less than 90%. He is conscious and can breathe spontaneously. The nurse is going to give him common oxygen supply. In common oxygen supply, the concentration of inspired oxygen cannot be adjusted, and the flow speed cannot be accurately adjusted either. High-speed oxygen inspiration and warming cannot be performed. There is obvious leakage of gas, and the accessories bring little comfort. The temperature probes at both ends of the tube can accurately monitor the temperature of the gas going through the tube, and the heating wire inside the tube can perform heating and keep a constant temperature. With professional oxygen therapy functions, SV300 can provide more comfortable and effective oxygen supply and treatment for patients. The doctor will use a medical humidifier to provide patients with constant air temperature and humidity. Keep the humidifier working for more than 10 minutes to stabilize the temperature and humidity of the gas before starting the ventilation. Oxygen therapy differs from mechanical ventilation in that A. No expiratory tube is used in oxygen therapy, and B. Gas is directly exhaled by the patient into the room during the expiration stage. The cannula connection can be swiveled full 360 degree and attaches to a standard 22mm inspiratory limb or a proprietary circuit. The lanyard prevents giving extra weight to nares, and it can be quickly released or adjusted to ensure patient safety. The prongs are made of comfortable materials. The wide bore design can reduce gas jetting and closely fits to the inside of the nostrils of the patient. The prongs are suitable for long-time usage. The tube is very light, and twisting and condensation is reduced because of the special material. A nasal cannula must be used by a single patient for a maximum of 7 days. For patients that low-flow oxygen supply is not sufficient, the nasal high-flow NHF oxygen therapy will be the solution. Delivering high-flow oxygen via nasal cannulas can ensure oxygen concentration better and reduce air dilution and leakage. This also ensures changeability and continuity when the ventilator is removed from the patient, or when the patient's condition becomes more severe. High-flow gas that directly goes into patient's nostrils will generate scouring of the throat. The anatomical dead space of the upper airway receives scouring of high-flow gas, and thereby builds a fresh air storage for each breath, which can reduce re-inspiration of carbon dioxide. The friction between the pharyngonasal cavity and gases passing through, as well as the friction inside the gases, will result with obvious resistance against the airflow. This resistance accounts for 50% of the total airway resistance. In NHF oxygen therapy, gases are supplied at a relatively high speed, so the pharyngionasal cavity does not expand during inspiration, thus reducing inspiration resistance and avoiding respiratory work needed to overcome that resistance. It is proved that nasal high-flow oxygen therapy increases the average airway pressure of the whole respiration cycle and can yield clinical results similar to those of CPAP ventilation. Warmed and humidified gases can facilitate lung compliance, enhance the conductivity and defense functions of the airway, and reduce airflow resistance, as well as consumption and dissipation of body heat. By giving the optimal humidity and temperature, functions of the mucociliary system can be maintained, sputum can be cleared more effectively, and the risk of respiratory system infections is reduced. The optimal humidity is the humidity level at which mucociliary clearance functions are maintained. Air supply under the optimal conditions, with a temperature of 37 degrees Celsius and a saturation of 44 milligrams per liter, can prevent water loss of the mucociliary system and maintain mucociliary clearance functions.
Would you like some water?
Thank you.
Compared with masks, nasal cannulas can give patients more comfort and higher adaptability. Patients with nasal cannulas can continue to eat, talk, and sleep without being interrupted for treatment purposes, and can obtain similar treatment results as given by mask oxygen therapy or low-level continuous positive airway pressure (CPAP) ventilation. Recent clinical studies have shown that after the ventilator and tube are removed during invasive ventilation, the NHF oxygen therapy can improve oxygenation and reduce carbon dioxide retention. And for patients with acute hypoxia respiratory failure, the NHF oxygen therapy can improve the hypoxia condition and prognosis, and the treatment results are similar to those of non-invasive ventilation. In endotracheal intubation and tracheotomy processes in the past, pause of oxygen supply often led to decreased oxygenation, but the NHF can achieve continuous oxygen supply during whole treatment, thus avoiding such problems. NHF oxygen therapy can also be applied for patients who refuse endotracheal intubation to improve hypoxia and cope with respiratory difficulties. For mild-moderate ARDS patients, patients with chronic obstructive pulmonary diseases or cardiac insufficiency, patients who cannot tolerate non-invasive ventilation, and patients where the ventilator and tube is removed after invasive ventilation, the NHF oxygen therapy can offer better clinical experience in terms of oxygenation improvement and reduction of carbon dioxide retention. We are following a patient with general anesthesia intubation from the operating room, OR, to the post-anesthesia care unit, PACU. The patient will get ventilation and monitoring continually. The ventilator is small-sized and flexible, and provides a wide range of ventilation modes and weaning management functions. It is suitable for the gradual transferring from complete mechanical ventilation during the operation to spontaneous breathing for patients, and it's more suitable for patients in the PACU. Endotracheal intubation can be removed after the PACU anesthetist determines that the consciousness and muscular tension of the patient are gradually recovered and meet extubation requirements. Switching between mechanical ventilation and oxygen therapy is achieved by enabling the oxygen therapy mode and changing the mask for oxygen therapy without the need to move the patient or change the ventilation equipment. The aluminum sheet of the nose clip is highly resilient, and the latex-free headband does not cause allergies easily. The mask has two one-way valves, which open during expiration to maintain a high oxygen concentration. The mask is made of lightweight medical-grade PVC compounds, which makes it more compact and reduces allergy. It can only be used by single patient to avoid cross-infection. In the oxygen therapy provided by the SV300, the concentration and flow speed of inspired oxygen can be adjusted, and high-flow oxygen delivery of up to 50 liters per minute is supported. O2 therapy supports count up and count down timer function. The O2 concentration, flow speed, and SpO2 are monitored in real time during the oxygen therapy process, and alarms will be generated when there are abnormal conditions, ensuring safety and controllability of oxygen therapy. Caution for O2 therapy with SV300 ventilator. During O2 therapy, all physiological alarms are muted except O2 concentration and SpO2 module physiological alarms. Expiration-dependent ventilation parameters such as airway pressure, expiration flow, minute volume, or apnea are not monitored. Use SpO2 monitoring for patients who are dependent on O2 concentration. Otherwise, a deterioration in the patient's condition may be recognized. Only use O2 therapy masks and do not use NIV masks for O2 therapy. The patient may be at risk if unsuitable masks are used. The O2 therapy system will make some continuous positive airway pressure, CPAP, to the patients. Please use cautiously when the patient has contraindication for CPAP. Thank you for your attention to Mindray SV300 ventilator. We hope that the oxygen therapy function of the SV300 ventilator will bring convenience and safety to your medical work, as well as comfort and health to your patients.